Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N. Court, Dublin, California 94568. And my phone number is 408 687 1899. Email address homeomedicine homeomedicine@yahoo.com. Anytime when you are suffering from any disease at any age and tired of any treatments, please call me for your second opinion of your treatment as well as of the your disease. So that I can call you, I can give you a guidance regarding to the natural process of running of this body, as well as of the treatments and a routine of the treatments in a natural way. I can guide you what are the reasons behind the stoppage of progress in your treatments. So you can call me at 408 687 1899. So let us come to the today's chapter. We are passing through the chest area. And in the chest area, we have discussed about the organs in the chest, major important organs, and we have divided this chest area into three different compartments. Two compartments are taken up on the sides by the lungs, right lung and left lung. In the middle, it's a heart, but the heart is also a part of the middle area. And the middle area as a whole is known as mediastinum. Basically, mediastinum is a common pathway for all the blood vessels of all these structures which are passing from head to downward and from downward to upward. But this area is also you can say the pathway. This pathway is also containing an organ which is a major important organ of the body as well as of the chest area, that is the heart. And in my previous lectures I have given you description of the hearts, how the heart was formed, when it was started forming in the mother's womb, after the fertilization of the ovums, and after that when this heart started forming. Okay. In this in this area, the major important organ of heart, we have discussed that how many chambers it has, what was the function of these different chambers, what they contains in it, and where they transport their stuff, means the blood, whatever blood is coming, and how it circulates throughout the this cardiac area or the heart areas, from where it comes, where it goes, from where it collects, and where it goes. So means, just like I explained you that the whole body returning blood is collected into the right chamber of the heart, the right upper chamber. That is the atrium, right atrium. From the right atrium, it goes down to the right ventricles. And from the right ventricle, it goes to the lungs. And from the lungs, it goes to the left side of the heart. That is the left atrium. And then it goes to the left ventricle. And again, it starts a new cycle to go to throughout the body to each and every cell. So this was a routine, and that routine was guided by the blood vessel, just like the pulmonary artery. This routine was guided by some valves, and these valves were and these valves were sorry. Yes, these valves were guided by the this flow. So they are guiding flow, and these valves are of different kinds: bicuspid valves, tricuspid valves, and the semilunar valves. So all the description has been given to all of you, even the surface anatomy of the heart. Suppose if from the chest, bare chest, you can say, and if you see a chest of a patient, and you can outwardly locate that where is the atrium, where is the mitral valve, where is the aortic valve, where is the pulmonary valves, and all those things. I have given you the description of the surface anatomy of the hearts, valves of the hearts, and their functionings. I also described in this area that right side of the heart has no relation after the birth with the left side. But in the mother's verbs, they are having a relation. The atriums above, right atrium has a relation with the left atrium through the foramen oval, which was automatically closed when the child is born and comes out of mother's verbs. And if it is not closed, it's a complication, it's a medical anomalies, and it's a problem. A surgical interventions now is going on, but ultimately it is considered that within 18 months of the life, new life, it is closed because the blood flowing through its normal routine from right atrium to the left right ventricle, and from right ventricle it goes to the lungs by pulmonary artery. So in this way, in this way, when the bottom of any utensil is open, any pot has open valves downward, then it do not overflow outwardly. So therefore, automatically there is no use of the foramen oval, which is at the top on left side of the heart. So in this way, this natural processes was going on, and I described you everything about that one. We will discuss the different diseases when we will come to the diseases area, that what are the diseases in this way, and where these are diseases, and what are the signs and symptoms of those things. But normally I give you the description of most important structures here in this area, and also I have described the pericardium membrane. This membrane is covering the heart and is separating it from the lungs. Other thing I have described, that the lungs, both lungs, I have described you that the both lungs has five lobes. Right side has three lobes, two, and left side has two lobes, but there is a one lingula, small lobes, you can say, that separates the heart from the lungs as well. But the function of that area is also just like the other lungs substances. So in this way, I have described you about the lungs and the covering of the lungs area, that's known as pleura. And I have described the pleura, that this is a double layer membrane, and one layer is known as visceral layer, the other layer is known as parietal layers, and the parietal layer is attached to the boundary of the chest outwardly, and the visceral layer is attached to the lobes of the lungs. And inside the lungs area, the lobes are not attached to each other. They do not have any direct connection. They do not have any direct connections, and their connection or the relation is maintained by the outwardly blood vessels entering into the lungs, and the nervous system, and the bronchial tubes, whatever is entering from outside, from the medial side of the lungs, in the hilum of the lungs, you can say. And this is the relation in between all the lobes on right side and left side. No other relation in between the lobes. That's why it's a safe side. It's a safe side, that at one time, if one lobe is affected, it's not necessary that the other lobe will be affected. If it's a one substance, then definitely it will be. It may be that all the lobes will be affected at one time. But normally, because they do not have interrelation inside, and one lobe is affected, and that needs to be treated, and the other lobes are safe, and the respiration is going on, oxygen is taken care of for the body in this way. So also I described about the pleura and its complication, and the pleurisy, dry pleurisy, wet pleurisy, all these things. And after that, we describe the diseases of the lungs, just like asthma, bronchiectasis, bronchitis, pneumonia, uh, cancer. All these things we have been discussing, but these are the short description. This is what I give you in this chapter, the short description of the diseases which generally person can suffer in this area. So diseases of the heart, diseases of the lungs, we have discussed. And after that, we have started the middle area of the chest. And I told you about that one. The middle area of the chest is about, if you cut this chest into three pieces, just imaginary cut into three pieces, the middle area is about 8 inches approximately, maybe little more or less, 8 inches. And if you take two cuts directly goes to backward, from sternum to backward, on both sides of the sternum, from the mid sternal line, 4 inches right side, 4 inches left side. And if you cut these, and goes back up to the vertebral column in the back side. So this is area which is known as mediastinum. Mid mediastinum. And this mediastinum, as I told you, it's a very, very important area. Mostly what happens? Uh, we keep our stuff, costly stuffs, in a very safe area. Safes and all that, even at homes, we save our costly, precious things in the safe areas. The same thing the nature has done. The more important, more safe areas, the connection between the upper area of the body with the lower area of the body, also through the chest and the chest area, they are enclosed in between the lungs and also the heart. Though the heart is also a part of the mediastinum. So mediastinum is a middle area in the chest, and it has very important structures passing through this mediastinum from upward to downward, from downward to upward. And also, they are originated from this area and goes upward and goes downward from the lungs and also from the heart as well. So in this way, just like I described you the superior vena cava, inferior vena cava, I described which are bringing blood from upward to downward, and I also described the carotid arteries which are supplying blood to the brain, and they are originated from the arch of aorta, and I described the aortic structure over in this middle area, that the aorta is released from the left ventricle, from the bottom place of the heart, that is in the fourth intercostal space. And after that, it goes upward up to the second intercostal space on the left side areas. And from there, it has a arch which goes backside. It is diverted to the backside, and from that arch, there are two arteries originating, that is known as carotid artery, which are going upward to supply the blood to the brain. And the other portion of this aorta goes backward towards the vertebral column to go down into the chest area as well as to the abdominal area to supply the blood to the lower portion of the body. In this way, we also describe about the bronchial trunk and main bronchus and the junction of the bronchus and also the bronchial teeth. This all falls into the mediastinal area, the middle area of the chest. And also, I describe you the subclavian vein, which is bringing the food stuff, fresh food stuff, which is ready to be mixed into the blood, and it is mixed into the blood at the subclavian vein, and that also is on the left side, and it is also in the mediastinal area and the superior area, superficial area at the top of the mediastinum. Because when I was describing the mediastinum, and just I told you, we have divided it into the three portions. Right side are lung area, left side lung area, and in between these, the mediastinum, and mediastinum is also enclosing the heart especially. But if all the three areas, mediastinum, both sides of the lungs, If the superficial area you cut down, make it separate by with the imaginary lines, all these structures, just like the aortic arch, main bronchus, and many of the other blood vessels structures I told you, just like the arch of aorta and all these, they are lying into the superficial upper area of the mediastinum and all others, because all these most of important structures are diverting towards the backside. They are originating from the front side of the aorta and front side of the epiglottis, and then they are going towards backside, to the safe side, towards the vertebral column. And alongside the vertebral column, they are going down to the abdomen sides. So this is what I have described you, and all because we have cut down the upper area, and as we have divided the portion, 8 inches portion, which is going from the front to the back side, we, for the description purposes, we can separate 3 sections, different sections of this mediastinum. Rather, all the upper superficial, we have cut down all the areas. And these important structures, I have told you, these belongs to the superficial area. But the underneath area, also we can divide into 3 portions. The anterior portion, the front portion, which if you separate the sternum from the chest, and what area you see, that is the anterior portions and the interior mediastinum. And after the interior mediastinum, there is a middle mediastinum. And after the middle mediastinum, there is the posterior mediastinum, which is close to the vertebral column in the back sides. So all these 3 portions were having a different organs. At the superficial portion, I have told you, which is all along the 3 sections. Superficial area, just like the heart area, I told you about that one. The trachea bifurcations, I have told you. And in the middle area, there is a tracheal bifurcation when the 2 bronchus goes towards the lungs, that area, and heart, and also the esophagus, mainly the food pipes. So this food pipe is also going towards back alongside the vertebral column and going down to the abdomen to reach to the stomach. So in this way, I have described you about the description of these areas, what organs. So again, I can repeat it. In the superficial area of the mediastinum, first of all, I will repeat it. We have cut imaginary lines in the chest, where on both sides, right side is left lung, right lung, and left side is left lung, and we make a cut in the chest from front to back. And this is the mediastinal area. And from this area, if you cut upper area, a small portion of the this mediastinum, that has enclosed in it most important organs which I just described, the upper portion of all these things. And if as a whole you consider that what are the organs in this area, that is the thymus gland as well. I have not described that. The thymus gland is an important organ inside our body, above the heart, which was originated even in the mother's web life, when the newborn child was growing up as a fetus, embryo and fetus. At the age of embryo, this thymus was helping as a immunity structure for that life which is being created inside the mother's web. So and after that, when the child is born, it starts its own immunity by the you can say the blood cells, WBCs, and all that, which are originated or formed inside the long bones. After that, when they are competent to take care of their self, then ultimately this thymus gland was squeezed. because there is no more function for that one, just like a retired person. This thymus gland becomes a retired person. And up to the teenage area, this thymus gland still remains active and helps time to time for the body to maintain its immunity and protect it from the toxic substances circulating inside the body. Just like many times I described that blood from the heart, it goes to each and every cell by the arteries, and from each and every cell of the body the blood comes back after supplying the food and oxygen and carrying the you can say the garbage of that cell, and comes back by the venous drainage. That is known as venous drainage. By the veins it is drained back to the heart. But especially if there be any excess damage somewhere in the organ, somewhere in the tissues, somewhere in the cells, and they are producing more garbage than normal, then ultimately those excess of garbage coming back towards the heart can block the circulations, can block the venous congestions, cause the venous congestions, and ultimately nature has set up another channel that is known as a lymph channel. So everything is filtered into the lymph channel so that the normal blood flow backward will go normally, and circulation will be maintained. Artery and venous circulation is maintained because there is a lymph channel which is collecting excess of the garbage, which may be dangerous to the other organs inside the body. And to protect the other organs of the body, this separate channel of the lymph channel is working over there. And ultimately we know that there are different lymph nodes in the different areas of the bodies, wherever these type of extra structure, extra stuff is collected, that is toxic, or you can say the garbage. But when these inguinal lymph nodes, axillary lymph nodes, neck lymph nodes, and lymph nodes of many places, they are filled up. When these are filled up and they cannot retain more garbage of this kind, that's known as lymph, they cannot retain that type of garbage, then it goes to the circulation of the lymph circulations, and ultimately it goes to the spleen, and spleen take care of all those blood cells which are being filled or being killed, you can say, by this toxic substances or the garbage of the cells. The spleen tries to clean up the blood. As far as it cleans up the blood means the WBC, you can say, mostly, because the RBCs are just the containers to contain the oxygen and hemoglobin part. WBCs are the forces, and they are killed by these type of toxins. The ultimate, the spleen cleans up all these things as far as possible. If the garbage is excessive, even beyond the limits of the spleen, then ultimately that garbage is cleaned up, and by the thymus gland, the last approach of our body to take care of these type of structures, these type of stuffs which is toxic and which is excess garbage coming from any organ which is damaged, which is having a type of diseases, just like the cancer. We mostly everybody knows about that one. And if there is a cancer in any part of the body, those cells means those cells are creating more garbage than normal. When the engine of the car is not working normally, and it's smoking more, then we go to the mechanics, and they just change some of the filters and everything. Same way, any organ, when it is damaged, and the diagnosis is the cancer, that these cells are damaged and they are producing excessive garbage, and that excessive garbage is going back with the venous flow, and the nature is filtering that venous flow into the filter, into the lymph channels, and the lymph glands are swelled up to its maximum strength, because they are filled up with these toxin substances, garbage substances, and the extra is flowing out into the lymph channels and reaches to the spleen, and then the spleen works on it to clean the rest of the and this lymph and clean up the blood cells to put it into the circulation again. But if it's more than that, if it's irregular there, because the cancer is not being cured at that time, or anything which is producing more garbage in any part of the body is continued under those conditions, that garbage coming to the spleen, if it is beyond the limit of the spleen to clean it up, then ultimately the last source of this cleaning goes to the this thymus gland. And that thymus gland is situated at the top of the heart, where there is the arch of the aorta and all that. So it is situated at that area, and take care of that one. If it cannot, this is the last resource, because up to teenage area, it is active, it is working fully, and it is helping to maintain the immunity of the body. But after that, the immunity of the body is maintained itself by the production of the cells inside the long bones, and they are taking care himself to the whole body and to the whole life. But if anything goes beyond their limit, it goes to the thymus ultimately. So thymus again becomes active, and the presence of the thymus gland, visuality of the thymus gland, you can say, is also a dangerous thing. Means something has gone big wrong inside the body, and which is causing a main danger to the body, because the thymus gland is a, you can say, and now it's visualized in this way. So this is the important structure is lying on the upper portion, the superior portion of the mediastinum. The mediastinum has three portions, and the upper portion of each, just like the body, the upper portion is the head. In this way, the mediastinum, which is running from sternum to the vertebral column, and its width is 8 inches. And if from the 8 inches from sternum to vertebral column, if you separate a portion upward, that is known as superior mediastinum. And that superior mediastinum has all these organs, because we have divided the mediastinum into interior, middle, and the posterior portions. And from all the three areas, we have cut the upper portions, or we have separated the upper portion. In the upper portion, these thymus gland remains. Heart area is also in that one. The upper area of the heart is there. The tracheal bifurcations. You know the epiglottis area in the upper lower part of the neck. In this way, that area is also into the mediastinum area. So just interior portion, just in front, just after you separate this sternum bone from the chest, you will see thymus gland if it's active, especially in the up to the teenage areas. After that, you do not see that, because the immunity of the body is sufficient to control that one, and then no more this thymus gland activity is required. So it is squeezed just like a retired person. It is just like a retired person, and the tracheal. So after that, in the middle area, also the main portion of the heart remains over there. Then the tracheal bifurcation was going to both of the lungs, or branches. Its branches are going to the lungs, so they are over there. And in the third area, the main important, because all the structures are having their course in the interior portion, in the middle portion, but in the posterior portions, mainly the esophagus remains over there. This esophagus is a food pipe. From the mouth, food goes down. The first portion is known as pharynx, and from the pharynx, it enters into the epiglottis area. And when it passes the epiglottis area, a special junction where the larynx and the pharynx are exchanging their route, and the respiratory larynx, which is released in the backside of the starts from the backside of the nose and goes to the lungs. The larynx comes forward, esophagus goes in the backward, and that esophagus is passing through this. And these all anterior, middle, and posterior portion of the mediastinum and the upper portion, and goes back to the vertebral column downward up to the stomach. So this is what these are the mostly I have described the organs of the mediastinum. Organs of the mediastinums importantly. And when we will discussing the diseases of the mediastinum, definitely then we will consider again thymus gland, we will consider again heart, we will consider again the bronchial tubes, trachea, and esophagus as well. So all these things will be discussed again, because the diseases are related mainly to these organs, will indicate something, and we have to differentiate it at that time, that whether the problem is in the esophagus, whether the problem is in the heart, whether the problem is in the respiratory link, that is the bronchus. So that we will ultimately describe you in later chapters. But here I am just giving you the simple, uh, you can say, description, that these are the organs. They are, if they are affected, they will indicating outwardly some signs, so that we can know that what organ is affected, what organ is sick, so that we can treat them properly according to that one. So after that, in this area, other than organs, these are the organs. These are the organs I just described: heart, head, thymus, and trachea bifurcations, esophagus. These are the organs. But there are some vessels as well. Vessels means those pipes which are transporting something, bringing or transporting everything, just like arch of aorta. You know that the arch of aorta is supplying the blood, is taking blood from the ventricle and supplying to the body, and it is coming from the left ventricle, goes upward, make a arch towards the back side, and that arch of aorta is known as a vessel. Heart is a organ, aorta is a vessel. So aorta also lies in this area because the diseases of the heart and diseases of the aorta are these some separate things. They are having separate indications. So we will describe all those things. And then the vessels, I have told you about the arch of aorta and major branches of the bronchial tree. Major, more main. When it is released from the epiglottis area, it's a main bronchus. Then it is divided into two branches, right side and left side of the branches, and also at that area from the from the aortic arch, there are two, you can say, carotid arteries, right carotid artery and left carotid artery. From here, they go upward on the both side of the neck and supply the heart to the the brain and the skull. So in this way, these are the vessels I have described you: aorta, bronchus, common carotid arteries. And the main important thing also I describe here was the subclavian vein. Subclavian vein. So subclavian vein, about that one, I would like to explain little more. When child was the fetus, you can say the child, everybody understand. Basically, there are different names. First name is embryo, and after that it becomes fetus. And when it comes out of mother's womb, it is called newborn, and after that is known as toddlers. And then in that way, we have divisions of as per the age is going on. So I'm talking about this thing, that when the child is in the mother's womb, at that time, mother is supplying food, mother is supplying oxygen through the blood, and the junction was placenta. And through the placenta, there are, it's also a type of custom department. because many medications or diseases or anything else, maybe a mother suffering from those, but those things are not affecting to the children's inside the mother's womb, because this placenta is also taking care of those things as a custom department. But just come, that blood from the mother is flowing towards the child through its umbilical, and it goes inside the abdominal wall of the fetus at that time. And then underneath the abdominal wall, this pipe goes to the liver. It is, you can say, the initial setup of the portal system. And at that time, when the body is formed of the fetus, the circulation is going through the whole body by the heart in the same way. Ultimately, the lower portion, the intestinal portion, blood goes back not directly to the heart, it goes to the portal system. So here I can tell you that blood is coming, fresh blood is coming from the mother via umbilical cord and goes to the liver, fetus liver, through the umbilicus cord. Also, blood circulating inside the body of the fetus, going back not directly like the, because the all other organs, this is a simple thing, blood coming from the heart going back to the heart, coming by artery, going back by veins. But there is a difference, there is some alteration to this rule, that the an intestinal blood do not go directly to the heart, it goes to liver. And now I am talking that when child is inside mother's womb, the blood coming from the mother is also passing from the umbilical cord and umbilicus. It also goes to the liver. So two type of blood is mixed and going to the liver, circulating inside the fetal body, that is going back towards the liver, not directly to the heart. And also the fresh blood which mother is supplying is also going to the liver. And liver acts on that. Liver acts on that. There should not be excess of sugar, there should not be excess of cholesterol, there should not be excess of anything. So it subdivides everything. It has its own measurements, so that it can send back blood to the heart in a quantity which is required by the body. But if anything comes in excess and it is not controlled by the liver, it goes the same way and circulate into the blood, and we say, oh, you are having sugar, oh, you are having cholesterol, and all those things. Means the liver was not functioning normally, it was not controlling the excess content of the sugar or of the cholesterol. That is why it is circulating. So this is what I'm telling you, that this two type of blood, when child is in the mother's womb, two type of blood, one coming from the mother, the other coming from its body, the lower body of the intestines, you can say. The intestines, it goes to the liver, and from liver, when it acts on that one, it sends this blood via the azygous vein to the heart. So azygous vein is also a vessel. So this azygous vein is also situated in this area, upper area of the, you can say this, mediastinum, azygous vein. And the second thing I want to tell you, that when this circle is cut off, the child is born now, and we cut the umbilical cord, one source is finished. The other source, which is known as the portal system later on, basically it was also a portal system, which was sending blood back from the intestines to the liver, that starts functioning properly. And that blood from the intestine goes to the liver, liver works on that one, and then by the azygous vein, it sends to the heart. And if heart is damaged, if heart is not working properly, or if the excess of things are coming to the liver, sorry, heart, not heart, liver. If heart is liver is not working properly, or liver is damaged, or if the excess of stuff, so sugar, cholesterol, and everything we have eaten, whatever, is coming back to the liver, and he is bound to control that, he is unable to bound to control all these things, then all these things will go back into the ajagus vein and will circulate into the blood circulations, and we can check the blood and we'll say, oh, you are having sugar, you are having cholesterol, all these things will happen. So ultimately, one thing. Second, I told you, when we eat food, it goes downward through the esophagus, because we told you the esophagus is also a mediastinal organ in the posterior portions, posterior mediastinum. So this food pipe goes to the stomach, goes to the intestines, many more enzymes and many more acids and enterokinase, bile, pancreas juice, many things are mixed into that one, and then they are acting on this food, whatever we have eaten, whatever the newborn after that has eaten, that's the milk or food, time to time. Time to time, the food is changed. So this food is acted on by all these enzymes inside the intestines, and and they are squeezed at that time, and the active constituents, you can say the active constituents of our food stuff, whatever we have eaten, are squeezed out from the intestines, and intestines are having a covering on it that is known as mesentery, and that mesentery is collecting that squeezed active constituents of our foodstuffs into that and supplying it back, draining it back into the cisterna chyli, a trunk backside close to the vertebral column in the lumbar area. And every squeezed material from our food stuff or the active constituents of our food stuff, whatever we have eaten, squeezed, and that goes to the cisterna chyli, a trunk which is situated in the close to the vertebral column in the backside, in the lumbar area. And that is gradually filled up from downward, it filled up, upward, upward. Ultimately, it goes to the left subclavian vein. Clavicle, you know that clavicle bone, this is on both sides of the chest, upper bone, you can say, and which makes the shoulder on the outer sides. Underneath that bone, there is a vein which is draining back blood from the arm, as well as this cisterna chyli is filled up after food and drains its material into that blood which is going back to the heart. So these two things happens here, and this is also a vessel. Subclavian vein is collecting material from the cisterna chyli, and that is a collected material from our food, whatever we have eaten, and that is also being mixed into the already manufactured blood, already circulating blood inside the body. It's mixed up in that, because that blood is coming from the body, and that blood is empty of the foodstuffs, empty of the oxygen, because it has already supplied the oxygen to the cells, it has already supplied the oxygen to the cells, and coming back empty. And under those conditions, this already ready to be mixed up into the blood food material by the subclavian vein is mixed into it. And the second thing I told you, coming from the intestines, the blood, coming from the intestine, blood was supplied to the intestine as all other organs are being supplied. In that way, that blood goes to the liver, and liver works on it. Then it's sent back to the heart, and same is also mixed up and filled up into the right atrium. All these things are mixed up into that one, and ultimately they go to the right atrium, and then the right ventricle, and then to the lungs, and there they are discharging their carbon dioxide and all that gases and taking up the oxygen. And many times I have described about that one. It's a normal natural process, not very complicated. That oxygen is heavy, which is coming from outside through the nose downward into the lungs, and the carbon dioxide and other gases which were collected from the whole of the body cells are lighter, and then they rise up, and the oxygen goes downward. It is filled up into the alveoli of the lungs. I have told you about the branches of the main bronchus, right bronchus, left bronchus, then the bronchioles, and then the ultimately the alveoli. And the alveoli are like a leaf where the blood coming from the heart was collected. It was having garbage of gases, and the oxygen is coming from the nose and also reaching to the alveoli. Here, exchange takes place, and with this exchange, the carbon dioxide and other gases are released upward and goes outward with the expirations. And with the inspiration, air comes downward, which is having excess part of the oxygen, is filled up into the blood. And that also I have described you that the RBCs, red blood cells, they are non-nucleated. You can say non-living, basically not non-living, but just to understand this thing, these are the non-living part of the blood cells that is not active like WBCs, but they are the containers. They contain only that oxygen and carbon dioxides. So carbon dioxides and all other gases which are collected from the throughout the body, they are lighter, and they goes up and expelled out by the expirations. And the oxygen from the nose goes downward, which is heavier. Automatic process takes place, and those RBCs are filled with oxygen automatically with the pressure. And that pressure also I have described you, the whole body, inside the body, every cell of the body is a like fort, and that fort has no door to enter into it. But even then you see stuffs from one cell to going to the other cells, from other cells to going to the other cells. How? By the pressure. When outwardly pressure is increased, it pushes the stuff into the cell, and when the cells are filled, they push this stuff to the other cells, and ultimately it goes to the trillions of cells, and then the ultimate pressure rises, and then it comes back. Then it comes back the same way. Pressure inside is rising, it's going to the upward cell, pressure is rising, upward cell, everything is going back to the bronchial tubes, and also it goes out through the nose, or expiration, you could say this one. So this was, all these things are as a vessel. We are talking about the mediastinum. All these vessels are lying inside the mediastinum. And plus that one, pulmonary, we have already discussed. Another thing, the important venous vessels, you can say, important vessels, you can say. Something is going wrong.